My name is Juanita Charles. I am the founder and CEO of Manifest Magic Black Girl Cooperative. We are really excited during this first time really participating in the Black Maternal Health Week. So annually from April 11th to the 17th. And so the things that we want to do is really highlight the things that are important when we talk about maternal health, particularly Black maternal health. And so one of the things that we have found that a lot of Black moms do not utilize are doulas. And that is because I don't think a lot of us know what they are, what they do. And so I am here with Angel. And I am just really excited to have this conversation with you. And so I guess to start, I'll just let you introduce yourself.
So I am Angel Burns. Some people might call me Doula Angel because that's my name on social media. Yeah. This is Micah, my third. Yeah. I have been in Clarksville for about almost 3 years. Since I've been here, I've assisted about 5 families with their birth journey, whether that was pregnancy and postpartum. And I'm just happy to be here to answer questions.
So I guess the first question is what is a doula and what is the role of a doula?
Okay, so a doula is...
Hey, Mr. Micah.
Okay, picked up both your sides. A doula is a non-medical professional, so we support you emotionally, physically, mentally. We educate you about nutrition, can assist you to appointments, whether it's during your prenatals, even if you want us to go with postpartum. Really our job is to support you and your family and support you in the way that you desire. So no matter what the location is, whether it's the birthing center, the hospital, home, our job is really to support you, also educate you as well to make informed decisions. And then of course, if you're in the hospital setting, a lot of times educating you to advocate for yourself.
Oh, absolutely.
And also, if you want us to, then we advocate for you as well.
That's awesome. And I think especially the advocacy piece, because a lot of us, we don't know how to advocate for ourselves in that space, because sometimes you can think that things are wrong, but you don't say it because you're like, well, they're the medical professionals, say they know. I know that is what contributes to the maternal mortality, infant mortality, and just the disproportionate outcomes for Black birthing people. And so in your experience here for the 5 families that you have helped, when you look at the way you've helped, and then based on kind of maybe if they've had prior experiences, has there been anything specific that kind of jumps out that they've told you about that really made the difference?
So with them, of course, every single one was different. One was a multiples. So his mom had twins. There have been where either it was a first-time mom or it was a mom who was, it was her second pregnancy, but the first experience traumatized her, and she really wanted to make changes for the second time. There is a range from us managing nutrition, right? So I'm documenting, what are you eating? Was it salty? Was it sweet? Also talking to your provider, asking them questions, not being afraid to ask them. If they say, well, we're going to do this, okay, but why are we doing this?
Right.
Or if they say, well, baby's heart rate was too high, okay, but what's the standard?
Yes.
And then what was my baby's? So that way I can understand exactly how medical staff are rating things, how they're making judgments. I think a lot of times, like you said, we trust the medical providers because that's their job is to provide care.
Absolutely.
And we're like, well, you went to school, you're certified. However, everyone wasn't certified correctly. I don't know if a lot of people even knew this. I went to a conference last year, but in a lot of the nursing books, it was stated, like this was recent, it was stated that a lot of nurses were taught that Black women feel less pain than our counterparts. And that's being taught. Like that was like recently. Like, that it was by Pearson. And they're known for their books, right? So
absolutely.
Like they had to make a statement and they had to draw it and apologize. But it was way past 2000. Like it was like 2018 maybe. When people pick that up, like, hey, like this is what they're teaching. So, and a lot of times with medical staff, a lot of them, they don't have bedside manner either, right?
True. Yes, true.
Because they're not taught to have bedside manner. So, at least for me as a doula, I wanted to be a nurse. I actually was going to school when I first got out of high school to be a pediatric critical care specialist. So I started out as a CNA. I started out as a home health aide. I worked from bottom going up, and then when I was working as a CNA and I was under a nurse and I saw how the nurses were pretty much treating me as if I didn't know what I was talking about when I would bring concerns to them. And it's, I work with these people every day.
Yeah.
Like, how can you dismiss what I'm saying just because you have RN behind you?
Right.
So, and I'm not saying that's all nurses, but you know, that can come up.
Yeah.
So sometimes, like, even the nurses in the hospital, some of them aren't mothers yet.
Yeah.
Right? And so, like, we're like hoping that they can have the compassion, but motherhood is one of those things where you could tell somebody all day about it, but they're not going to know until they go through it.
Absolutely. Yeah.
So same with labor. It's unfortunate that, you know, like a lot of mothers have to go through trauma.
Yeah.
And, you know, feeling unheard because unfortunately our, you know, medical system in the United States is just not as good as it could be.
Right. Going back to like that bedside manner, you're 100% on point. I can see how it would really affect a person's experience, like with birthing. I know, like, there was, when I had to stay overnight, it was very much like, okay, we'll be back to check in. Okay, but you didn't check to see what I need now. Like, what do we, you know? I did end up with one very good male nurse after the other person left, and he was just very attentive. But I say that to say, I can imagine the difference that it makes to have you there to advocate and really just to kind of make it a more pleasant experience than dealing directly with somebody who may not be interested in doing so. So nutrition, definitely just being an advocate. And then as far as like before you kind of ease the journey, maybe do you help them understand like what to expect, or, you know, with how does that work?
Like when they're hiring me?
Yeah.
Okay, so like so I offer free consultations to anyone who is seeking services.
Yeah.
And I go over pretty like exactly how I operate. I am not a doula who's judging you, who makes you feel like, well, if you don't choose this, then like no, because I always tell people you're gonna remember this. I'm not.
Yeah, right.
I serve so many people. There are certain things that I'll remember, but I'm not gonna remember every detail.
Yeah, absolutely.
And then their experience or their remembrance of it, you know, I want it to be as close to as memorable and good as possible. Absolutely. I don't want them going back like, what if, or I shoulda, coulda, woulda.
Yeah.
So in my consultations, I let them know my job is to educate you. That's all my job is.
Yeah.
Now, I give you the risk and the benefits. It's up to you to make that decision.
Yeah.
So that way, at the end of the day, I don't ever want you to say you weren't educated or I didn't answer the question. And I always tell people, if I don't know something, I'm going to go ask my colleagues. I'm going to pull out my books. Because I am always, especially like in this field, things change every day.
Yeah.
So I don't know everything. I'm not always going to know everything. But I'm going to go and ask someone and double check. I'm going to get like 3 opinions before I come back to you and say, okay, this is what I found out. But in those consultations, it's just really me asking them, getting to know them. Have you had any trauma? Have you had any miscarriages? A lot of people don't realize that if they haven't healed from something like that, that definitely comes along with you in your pregnancy journey, because you're always having those subconscious thoughts about, well, what if I don't do this, or what if this happens? Yeah. And I want you to be fully healed. And I also explain to them that birth is sacred. Yeah, so in that moment of when you're completely vulnerable to the people around you. Yeah. So think about the space. What brings you peace? Because that's how we're shooting for the environment for you. Is it dim lights? Is it quiet people? For me, when I had my 3rd year, a lot of people were like, are you hiring a doula? Are you birthing at home? A lot of people gave me judgment because I didn't birth at home. I believe in Western medicine and I believe in traditional medicine or herbalism. And that's because I feel like we work together. There's some things that herbs can't do. There's some things that medicine shouldn't do.
Right. Oh, yeah, absolutely.
So for me, I had to explain to people like, this is my birth journey. And I became a doula because my first birth experience, I had a great medical team. I was begging for a C-section. Like, first time mom, I'm young. I'm like, this is awful. Like, who goes through this? And they were, no, mom, no, we don't want to give you anything. Postpartum was where I needed help, lactation-wise, but I didn't have it. Because when I went home, you know, when you go home, there's no more nurses. There's no more. And I didn't know what a doula was at that time. My second, of course, it was right before the world shut down from COVID. So all I could have was like maybe just my mom, my husband, and my daughter at the time. But being at home, you know, helped me because I had my husband at home. I had my sister-in-law, my mom. I had all these people. Again, my support was great. However, when I was in the hospital, though, because they deemed that my son was coming early because he wasn't coming on their due date. I think they said he was due Christmas, and it was December 3rd that I was in labor.
Oh, wow.
Yeah. So at that time, you know, it's just me and my husband. I'm waiting for my mom to fly in. I remember them putting something in my IV to stop my labor, even though I told them, no, I'm full term. Like, I've been pregnant before. are. No, I'm full term. To them, it was no, you're not. And so, of course, but I'm in and out of it. So I distinctly remember them doing that. And so for me, I'm like, see, I don't like that because you waited for my husband to leave to do that to me.
Yeah, you had an agenda already.
Yeah.
You decided,
And then for him, for the backlash from people, other birth workers, whatever, I'm like, the hospitals aren't bad. Like, we were still dying at home.
Yeah.
Like, there was a time, like let's not do that. Like, because birth is dangerous. It's traumatic to the body.
Absolutely.
So no matter where you are, anything could go wrong.
Yeah.
However, it's the fact of making sure that we are making you comfortable. The doula's job is to support you, make you feel supported, pour into you.
Yeah.
Now, of course, like, please heed, again, like, we have we have a midwife, we have doctors, we have nurses. We are relying on them, for their medical expertise and guidance. So same thing as a doula. You're relying on me for my guidance. However, I'm not going to push you.
Yes.
I'm just going to allow you to make the decision that's best for you.
Yeah.
Right?
You just kind of set the expectation. And then at that point, you can decide. And like you said, when the major decisions come about, hey, these are your options. If you do this, this happens. If you do this, this happens. What do you want to do? And that's really the best way you can do it. What is the difference between a doula and a midwife?
So the midwife is the medical professional. Now, it depends on what kind of midwife you hire, because all midwives are not the same. You have your certified nurse midwives, you have your certified professional midwives, you have your certified traditional midwives. Oh, wow. So it just depends on what they offer. Some of them can offer you pain medicine. Some of them can suture. Some of them only work with herbs. It just depends on what you're looking for. And that, again, is a whole nother thing, for families, all of this, even from your providers. Like, absolutely. We go to OBs and, we're like, oh, well, but, again, like, the same way we're vetting them, it's the same way you want to vet your midwife. Are they the match for you? Even for me, am I the doula for you? A lot of people think I don't support home births because I get hired a lot for hospital births, but a lot of those people hire me because they want to feel supported. They want an advocate, and there's nothing wrong with them wanting to be in a medical facility to give birth. It's just their preference. Some people are not, like, do not want to have a baby at home. I tell people all day, do whatever you want to do, because I'm an epidural me, please. Yes. And I know the risks and the benefits, but that's my choice at the end of the day. And why should we be judging mothers based off their choice?
Absolutely.
Do what works for you, because again, I'm not gonna remember. I remember my birth.
Yeah,
I'm not gonna remember, anybody else's. So, but with the midwives, they are the medical professionals. Doulas are not medical. We do not deliver babies. A lot of people think that we do, or we're supposed to. Now, there are some doulas who may take a course on how to. They call it catching the baby. However, I don't do that. Like, I leave that. That's out of my scope. And again, like, there's a role for everybody. So so doulas, we are just there for the emotional, physical, and mental support and the education portion. The midwives, they would be your OB if you were going to the hospital.
So is there doula, midwife, and then like a nurse, whoever's at the thing, or the midwife is a part of the medical team from the medical facility, I guess?
So, because you mean like when you go to the hospital and they have like a midwife and then they have the OB and then they have the nurses?
Like, is that what they have? I don't remember midwife at all when I was having a baby.
So now, because they're allowing, like, there are, more nurses who want to be midwives.
Oh, okay.
Or just people who want to be midwives. So the midwife can see you just as much as the OB. It's just about their scope of practice. Like the OBs, typically, I'm thinking, like, if you go to the hospital and, like, if your OB is not available, you may see the midwife. Or if you go there and there's a choice for you to see a midwife, you can. It's just more of, like, their scope.
Okay, so understanding that you need a doula regardless of how many midwives, nurses, everything that are there, because you provide very different services.
Yeah, even like if you're, let's say if you're at the hospital and then, like, you're waiting for the doctor to come in, the midwife can come in as the doctor. Okay. Like if that's your choice, or if there's no doctor, the midwife will come in and see you.
Gotcha.
Again, like, it's the same, but, like, there's just some differences as far as their scope.
Okay, and so when that happens, you should still be there as a doula, or a doula should be there still to advocate, because no matter what you're...
always. So the doula, we're always going to be... So when you think about it and you're, like, at home, or you're, like, if you're at home, when you're having a home birth, the midwife is not coming until it's time for the baby.
Gotcha.
The doula is there to the support.
Yeah,
right?
the entire. Okay.
But when it's time for the baby, it's called the midwife.
Yeah, gotcha.
Same thing like in the hospital, it's the nurses.
Okay.
But then when it's time, they go and get the doctor.
Gotcha. Okay, so what you're saying. Oh, okay, good. So you do all the prep except for the quote unquote catching the baby, unless you take the course and you do that.
Yeah, unless you are, if you actually have, if you're certified, different things like that. Because I know like some people have said they've gone through courses. I haven't done my research to see what is available. Mm-hmm. But yes, like if you are hiring somebody to do that, please make sure they know what they're doing.
Yeah. Yeah. Check certifications.
Yes.
For real. Okay. Man, this is really interesting. Is there anything in particular that you would like to add or like that you want people to know?
I mean, because for Black Maternal Health Week, I think it's just more outside of than just birth and doulas.
Absolutely.
You want to make sure that like health-wise, you are asking questions. You're going regularly to the doctor, right? Because a lot of times we're like, we don't go unless we're sick.
Yeah, absolutely.
Or we are not good with like our own personal medical care.
And that is definitely a cultural thing.
Yeah. And so it's really important that we do that. Go to your yearly checkups. If there's no doctor, if you don't like your doctor, find another one.
You know what? That is a really good point because I've had a lot of people like, I don't really like them. Okay, we'll switch. Well, I don't know. No, you actually have the option to choose somebody that you feel comfortable with because I guess in so many words, your life is in their hands. Like, if we call it what it is. So we do recognize that there is a complicated relationship with the Black community and the medical profession. Mm-hmm. So we definitely want to acknowledge that. So as you're saying, like taking care of your health. Okay.
Yeah, absolutely. One of the things that's prevalent like in our community more is diabetes. A lot of us aren't, realizing that we're pre-diabetic. We're on the verge of becoming a pre-diabetic, or even just turning into like actually being a diabetic. A portion of that goes into it too. Yeah. So just, making sure like even if your doula doesn't offer, like childbirth education classes, or if they do, always seek more. Like, because you're always going to learn something different from someone else. Right. And then make sure you're asking for those referrals or resources. Who can you send me to, or who can you refer me to for lactation? Who can you refer me to for postpartum? Yes. A lot of times like the doctors at one point they were only seeing us at 6 weeks. That's too late. Yeah. Like 6 weeks, his mother has gone 6 weeks. She hasn't gotten assistance with lactation. She hasn't gotten assistance with how she's feeling. Yeah. She thinks that like she's supposed to go back to work. And that's a hard thing too. Yeah. Right? Because a lot of us don't have the means to not go to work. Yeah. So, just all of those things go into Black maternal health. Yeah, absolutely. And so it's just really important, that we see the whole picture and make sure that we are, if we don't have the resources or if we don't have the connection, then find it, look for it. Don't be afraid to reach out. Another thing in our community is there's a stigma that like if we tell them something's wrong, they're going to take our babies. Yeah. That's a real thing. Perinatal mood and anxiety disorders are much more, I think they are also 3 times to happen more in Black women than other counterparts as well. And so just speaking on the postpartum part, I do sit on the Postpartum Support International Board for Tennessee. Oh, beautiful. And I did, before I was pregnant or had my baby, I did host some of the online support groups for Black Moms Connect and military moms. So moms from all over, would join just to find that support. Yeah. Even with that, like talking to someone, telling them your thoughts, your feelings, your anxiety, what's happening, so you can get help. Yeah. And even if you feel like maybe like your doctor isn't someone that you can talk to, again, reach out, find a therapist. Yeah. Even if it's a doula or lactation, more than likely we know a resource that we can point you to. Yeah. So even with the postpartum part, a lot of times that's hard too. And if you like, that kind of ties into lactation. That's why a lot of moms aren't breastfeeding in the Black community. Yeah. Because you have all the stress, the socioeconomic factors. Are you getting paid on maternity leave, or is it the FMLA? You know, like, so how does that work? And some people don't even know to get their insurance. But if you do FMLA, some jobs actually offer you a certain amount of money that they will pay you. Oh. I don't know if it's disability. I know it's something. It sounds like it's almost like a workers' comp type thing. Like but I know it's not called that, but like I know like families can like ask your provider, because a lot of times we think think, oh, we're just going to do FMLA because that's the federal thing.
Yeah.
But no, jobs do. There's some of them do have another option where you can apply for disability or something, so that you can be paid something while you're on.
Yeah.
But people just don't know.
You know, and that's the other thing. Well, what I've noticed in our community is it's kind of like you just do what you think you're supposed to do, but you don't ask questions. Like, I know a person who should have, I'll just say, had a lot of time off from work because of some things they were dealing with. It was like, no, I'm just going to go in because I don't want them to say anything, or I don't want to lose my job. But you don't know unless you ask. And especially with this, like, I think because, you know, women have babies every day, right? Or birthing people have babies every day. So people feel like, oh, it's just something that comes natural and you just do, but that is not a real thing. Even when I saw the thing with Serena Williams, she was just like, I thought I was just supposed to be enjoying being a mom. She's like, and I wasn't. I believe that was her. And she was like, and I wasn't. She was like, but I didn't know something was wrong, or I felt like something was wrong, but who could I say, you know? And then so I believe that was her. But anyway, but thankfully a lot of those moms, they get help, but some they don't because they don't have a support system at all. So I really appreciate what you're saying because I think a lot of times we miss that. So postpartum. So during the, let's say somebody has postpartum depression, or what was the other term that you used?
I said perinatal mood and anxiety disorders. So it just ranges. So there's baby blues. So baby blues is within the first 2 weeks of you having the baby. But if you're still having these symptoms, then it's no longer baby blues, it's postpartum depression or anxiety. So some people, you know, if they like have this worry, or, you know, you're like, oh, like I gotta pick this up or do this or do that, or just the depression, like you're grieving your life before baby, you're grieving like your body is changing. A lot of times people think because the body is out, I mean the baby and the placenta is out, like, oh, you're back. No, like, no, yeah, like your body takes a very long time to regulate. And then a lot of people think, oh, well, if I'm breastfeeding, it's birth control. No, it's not. Like, that's such a myth.
I heard that. So can I say this? Look, I heard that. And why did, I'm gonna call her cousin, she's not my blood cousin, but you know we grew up together, so cousin. Why did my cousin go to her 6-week checkup and she was pregnant? Girl, she about passed out. But that was her thing. She thought because she was breastfeeding that she couldn't get pregnant.
People think that just because they're not getting a period. No, your eggs are still fertilized in there. So like you know, you've got that, and then like from the depression, then there's the psychosis. So, you know, where we're hearing stories of a mother has killed her baby, or a mother tried to kill her baby, or along those lines. And a lot of times people are not educated enough. There's not enough education out about postpartum psychosis. And that's real. Like if you're having those thoughts about, oh, there's that knife over there, what would happen if I just did this to the baby? Like those thoughts do creep into people's minds. Like, but like if you're having them, please like seek help, because sometimes you might think, oh, it was just a thought, but like if they're continuous and then they're happening more frequent, or even if like you start to hear, sometimes it's a hallucinations. You're thinking like, I don't know if we've heard stories, but where like people are like, no, like the government is listening, or no, like they're coming to take my baby, like really believing that, you know, somebody is out here trying to take your baby in that instance, because sometimes that does happen. But in the instance that we're talking about, or if they're like, I have to make my baby a sacrifice. No, I was told to make my baby a sacrifice. You need to call someone. You need to be checked in. You need to go seek help. The unfortunate part about when we are receiving help is the facilities are not always the best. Because people don't want to be confined. People don't want to be tied up. Like people just, that part. So we have a lot of work to do in the medical system, where we call ourselves helping people. And one of the things that definitely brought that up is when I go to the Postpartum Support International Conference every year, I meet people from all over the world, people from Canada, you know, and it's so like, in a way, like you're jealous because like over there, like they get the whole year off, right? And they get paid maternity leave to be at home. And it's like over here, like what are we doing? So
it's like you had that baby last week, girl, get back on her, you know.
And to hear them say to me, like, you guys' medical system, like I can't believe it. Like,
there's this lady, she told me after you have your baby, she said you should continue to take your prenatals for another 2 years. And I said, what? And now this is way after my third baby. And I'm like, well, that would have been good to know, because now I'm going bald because my baby, you know, she took all my nutrients and everything else. So it's, but when it's a lot of things that like we know, but it's almost like tribal knowledge, because they say it differently than how you would say it so we don't say, oh, well, you should probably continue to take these supplements because you're lacking these because your baby took them. They'll say, oh, my baby took my hair, or my baby messed up my skin. Like, I don't know if you've ever heard that, but my grandma used to say that. She's like, oh, the baby took your da-da-da-da. And I'm like, no, I need vitamins. I need vitamins.
So. Oh yes. I had very bad edge it just, my loss. Like when and I was like, oh my gosh, and people would joke, he's wearing them on his head.
Yeah.
So like that part.
Yeah.
But yes, like a lot of times people don't realize too with breastfeeding, baby's gonna take regardless if you replenish.
Yeah.
Baby is gonna take.
Yeah.
So, you know, even with that, yes, our nutrients, our vitamins, and you don't have to take prenatal vitamins. Like there's other ways, you know. I always ask my clients too, especially when they go to the doctor and the doctor is like, oh, well, you need supplements or you need this, or a lot of them, especially like you need blood transfusion or you need to get your iron up, right? Mm-hmm. And I'm like, if you're a person, because they always tell me that you're going to be anemic, you're small, okay, yeah, great. But this last time, I actually didn't see an OB or a midwife. I saw a nurse practitioner.
Okay.
A lot of people kind of side-eyed me, and I was like, she is the only Black one out at Vanderbilt. Yeah. And I wanted to see a Black woman. And one of the things I loved about her was, yes, she believes in medicine, but she always asked me, there's an alternative. So you could, you know, up your greens, eat these kind of foods because they're high and rich in iron. Yeah. So if you don't want me to prescribe you this, then this is what you need to do. Oh, and that I love, because it wasn't like she was throwing iron pills at me. No, I don't want those. But, you know, just to hear something else so I could make an informed decision.
Absolutely.
So yeah, so that, like just even
so it's like food as medicine, which is, you know, because that's where you're supposed to get your nutrients from. Mm-hmm. But you're right, people they'll throw pills at you all day. Yeah. And I'm not good at taking pills, so that wouldn't.
Oh, me neither.
Yeah.
So there's so much.
So then that really ties into, like you said, the nutrition piece of what you do. Is kind of like, as a doula, you can actually help support someone in a way where they're not getting a million pills thrown at them. It's like, okay, I asked your provider, they say this is what you do, they may want to give you this, but let me tell you. Mm-hmm. So that way if their doctor doesn't, or whoever their medical professional is, doesn't mention the nutrition piece, then you can assist with that. So that is...
Yeah, and I will say, I believe, because it was a couple years ago. I had a client, and I think her first pregnancy, I believe she told me she had preeclampsia and she had to be induced due to it. And so then, she didn't really get to breastfeed like she wanted. So the second time around when she hired me, she was like, I want to do this. I don't want to be induced, you know, things like that. And then I was like, okay, so this is what we're going to do. We're going to have to track your nutrition. Mm-hmm. And one of the things I loved about her, she called me about anything. Yeah. If it was like her stomach was feeling weird, I'm calling the doula. And I loved it. But because we stuck to a T, because I told her you cannot eat like heavily salty foods, you have to eat healthy, eat well, are you drinking enough water, you know, all those things. And I'm like, no water, I don't want to do, we're not doing the flavored water. And she did not have to be induced. She breastfed her baby until she decided to wean. Mm-hmm. And I think that was just beautiful, because a lot of times, like, you know, you talk the talk, but when you can actually see it happen, I think that's a whole other thing. So I always say to her, like, she was like my, like I love it, one of my success stories, because we worked hard. Like, I was on her, you know, about what are you putting in your body? Yeah. What are you doing? What are you watching it? Even into breastfeeding, a lot of people don't realize a lot of babies are allergic to dairy. They have a dairy intolerance. And so if you're a breastfeeding mom and you love dairy, baby, you're going to have to give that up. Yeah. Oh my goodness. The baby, you know, in their milk, they're not going to be able to tolerate it. And so, you know, with my breastfeeding moms, like or clients, if they're like, hey, like, you know, baby is, you know, spitting up more than usual, I'm like, okay, what did you eat? Yeah. What did you eat? Yeah. And so once they say like, oh, I'm like, let's cut the dairy for a little bit and see what happens. Just kind of tracking those patterns, and that's awesome. Yeah. That's not saying, like, because I know reflux is a thing too, so that's a whole nother thing. But I'm just saying for moms, like, if you know, like, breastfeeding has been going well, but then, like, you kind of, you know, stray away from your diet or you do something different, then my first question is, what have you eaten? Yes. So, yeah. Oh, man, that's... Woo, that was a lot. See, and I definitely needed to do it. I maybe had reflux and everything else. Then we found out she was lactose intolerant as a baby. And I'm like, goodness, like I've just been missing all the things. So that's really amazing. We have a friend in common, and she's always like, oh my gosh, you know, look at what Angel's doing. And so I'm like, yes, I see what she's doing. Like, how do we support her? So I'm really grateful that we get this opportunity. Even if it's a small way, I feel like we have been able to connect in a meaningful way. And so I'm looking forward to, I guess, just finding ways to work together in the future. And so we really want to kind of expand this moving forward. So I just want to say thank you so much to Angel for being here, just for the opportunity
opportunity to connect and to speak really frankly on really just the importance of a doula and how people can benefit. So with that being said, I would love for you to let people know how they can get in contact with you. Y'all should definitely hire her. Okay. So.
Yes, thank you so much for having me and for the opportunity. My website is www.angelscloset.co.